Why does drinking too much water cause seizures and coma? Now, this is one of the most fascinating concepts that will be tested on the USMLE. So, let me break it down. I will start by asking you a question first. What determines whether water moves into or out of a cell? Because if you understand that one principle, this whole thing will make sense. All right, so water follows sodium. Your brain cells are sitting in a carefully balanced environment where the sodium concentration inside and outside the cell is tightly regulated. Now, here's what happens when someone drinks massive amounts of water. We're talking liters in a short period. All that water dilutes the sodium in the bloodstream, serum sodium drops, sometimes below 120. Now you have a concentration gradient where the sodium outside the cell is lower than sodium inside the cell. So what does the water do? It follows osmosis and rushes into the brain cells to equalize the concentration. Brain cells swell, but here's the problem. The brain is trapped inside a rigid skull. There's nowhere for swollen brain tissue to go except down the foramen magnum. That's herniation and that's death. On the USMLE, they'll give you a psychiatric patient who drinks massive amounts of water, sometimes even more than 10 liters a day compulsively, and they will present with altered mental status, seizures, and then coma. This is called as psychogenic polydipsia. Now, here's the critical management point for this. You can't correct the sodium too fast. If you rapidly give hypertonic saline and sodium shoots up too quickly, you cause osmotic demyelination syndrome. The brain cells that adapted to the low sodium suddenly shrink as water rushes out and myelin gets destroyed. Patients end up locked in. So low sodium, so you need to make sure that you correct it really slowly. If the sodium is below 120 and the patient is having altered mental status and seizures or is in coma, you will give hypertonic saline. But if it is above 120, you end up giving isotonic saline